think I started my period at 9 years old, and I was very young, and they were very heavy, very painful periods. I would have to take about 800 milligrams of ibuprofen just to get through the pain for the first few days. And a lot of times it would soak through my clothes. We went to many different doctors. Nobody really could figure it out. They thought it was just heavy periods. They put me on birth control at a very young age. Although it put me on a cycle, it didn't do anything as far as the pain. I did go to a lot of doctors. My mom had endometriosis that she had a full hysterectomy for at probably 32. And so I knew that she had it, and it was something I was aware of. They thought that my periods were normal. They said, you know, some people just bleed heavier. Some people have a little bit more pain. They you know, have more cramps. You know, if it was a period of about 2 years where I was very sick and in a lot of pain. And I went to every specialist you could think of. And one doctor finally said that she wanted to put me on antidepressants because she thought that it was all psychological, that I really didn't have anything going on, and that it was just something in my head. You know, every MRI that they took, every CAT scan said that I had a herniated disc, and they wanted to do disc replacement surgery. I was going to the best of the best. I wasn't, you know, just going to any doctor. I was going to many doctors. I was getting multiple opinions. They were all telling me the same thing, and one doctor finally said, we need to do disc replacement surgery. This one doctor of mine said, absolutely not. I'm not going to let you go through with this. And we kind of realized that the pain correlated with my menstrual cycle. And even when I went there, they said, there's something there. There is a mass, but we don't know what it is. Nothing about endometriosis again. Everybody thought I had colorectal cancer. And we finally scheduled surgery at Hopkins. And there was a team of surgeons that were to be at that surgery. And they had specialists in many different fields because they didn't know what they were dealing with. And about 3 weeks before surgery, I ended up having to go to the hospital because I woke up in a pool of blood. And I was in so much pain that I was going into shock. And they took me to the hospital, and I was hospitalized for about 3 weeks before surgery on a morphine drip just to help me with the pain. And the night before surgery, the endometriosis was shutting down my bowels. I was in excruciating pain. And even when they went into surgery, they still didn't know what they were dealing with. He came out and said, you're very lucky because it had just taken over everything. The pain was gone right away because, you know, they told me there were microscopic pieces that they were not unable to get out. So I still had endometriosis, but the pain was gone for a while, and I got a bowel obstruction, and I had to go to the emergency room because I was in so much pain. I went into surgery, I think it was right after Thanksgiving. When I came out of surgery, he said, listen, there's something there, there's a big mass. You're gonna have to give me a little bit of time to put together a team of surgeons that can do this because I don't know what I'm dealing with. I never went with anyone's first opinion. I always, because I think the medical community had just failed me so much and had not been able to diagnose this. I remember going to one OBGYN saying, listen, I have endometriosis. I know I do. I have all the symptoms. I've done the research. My mom had it. It's not my back. It's not a herniated disc. And again, he did an exam and said, nope, there's nothing there. You don't have endometriosis. So yes, at that point, I was frustrated. I was tired. I was in so much pain all the time. I had no quality of life. And I remember telling a lot of people that I was considering going to see a doctor in Michigan, and they thought I was absolutely out of my mind. And I said, if you've been through what I've been through, you will go anywhere if someone will give you, you know, a glimmer of hope. I flew out here, and you put me on your treatment, and instantly, I would say, the pain went away. And it has not come back. I lost a big chunk of my life because of this, and I wish I would have found you earlier because I wouldn't have had to have that surgery. And I want people to know that, you know, yes, there is always pain. There's pain associated with getting your periods, but when it's excruciating pain, there's something wrong. If you have excruciating pain, you need to have it looked at, and you need to believe what you know. Women with endometriosis, I don't think either the doctors don't take them seriously, or they just don't have enough training to diagnose them. But we suffer a lot, and there's a lot of pain associated with it, and you lose your quality of life. And if I can help one person because of what I've been through, that's why I wanted to do this.